some scientific data to actually use in constructive conversations. But I do really want to ask all of you on the panel, we keep hearing about the great effects of the drug cannabis and THC is doing in a lot of our patient population. I want to hear your studies and results around some of the adverse effects. I'd much rather hear it from this panel than from the outside media. So what have you been finding out there in your studies that are unwanted effects of marijuana? I'd like to learn that.
Well, you know, all of our studies are done at the General Clinical Research Center, and the patients are there overnight for anywhere from 5 to 25 days. And we have had one patient left because he became dysphoric. He did not have a good reaction, and he said, I don't want to do this anymore, and left. And one woman had an episode of a rapid heartbeat, but stayed. She had had a lot of coffee before her morning dose, but you know, otherwise, maybe 2 other people got slightly paranoid. It's a question of set and setting, and smoking in a hospital room with nurses coming in and doing things to you every 5 minutes is, you know, can get you a little disoriented, and so they were treated with a little benzodiazepam and relaxed. But we have not had untoward effects in 200 patients smoking for 5 to 25 days, 3 times a day.
Related to that, like John said, when we're in the hospital setting, in lab settings, first of all, these people have been through extensive medical sort of screening to decrease the likelihood of those possible untoward effects. One, and then with our studies, these folks they have an extensive history of using marijuana, which would also decrease the likelihood of negative effects. And 2, folks who completed our studies are under the age of 45 in general. And so they're relatively young, healthy folks, all of which will decrease the likelihood of possible adverse effects.
Yeah, and then when I add to that too, I think Sunil Agarwal's thesis work is going to address a lot of those questions. We found a remarkably low clinical toxicity of cannabinoids. And if you want to speak in pure pharmacological terms, there's no LD50, that's the lethal dose, the dose that would kill 50% of the people taking it. It's 0. Aspirin doesn't even have, doesn't match that. Tylenol doesn't match that. Actually, Tylenol and aspirin are a pretty easy overdose. I remember when I was a struggling internal medicine intern, we'd always see Tylenol overdoses, kills the liver. Aspirin, you bleed to death. Alcohol certainly has a kid in my dorm when I was in college died from acute alcohol poisoning. So, and then in terms of drug-drug interactions, cannabinoids have very few significant drug-drug interactions. So pharmacologically speaking, it's remarkably safe. I can absolutely guarantee you that if a scientist invented cannabinoids, he would win, or he or she would win the Nobel Prize. I love to say, I said this under court, that God owns the patent on cannabis.
But you should also recognize, however, that it's difficult for physicians in general to prescribe sucking burning weeds down your throat, and so all of the concerns with tobacco are there. I mean, but Ethan talked about this earlier in terms of vaporization, and so until we move away from smoking, those issues, they are concerns.
For what it's worth, I've just finished the 11th participant in our randomized controlled trial for the vaporizer, and respiratory symptoms have dropped 50%, and that, blow in the thing until you can't blow anymore, those are going up between 9 and 11% for these first few participants. So the vaporizer is clearly going to sidestep a lot of the respiratory issues. The other thing I get in my data is just risk for dependence. And what are the symptoms of dependence? Well, gee, there's tolerance and withdrawal and some kind of problematic impaired functioning. And in truth, it's nowhere near the sorts of tolerance or withdrawal we see with so many other medications that are out there. So it's hard for me to get too worked up.
I would pick up on Carl's point, the rhetoric from the drug czar's office of course, is there's no such thing as smoke medicines, and this is really difficult. To further your question, and for everybody who's never seen it before, and because of the politics of business, somebody who should be on that panel that's not today is Dr. Ethan Russo, who's the chief scientist of GW Pharmaceuticals, a brilliant family. And LB, were you part of his, okay, so my point is here, there were 6 people in the United States smoking 14 ounces of marijuana a month, every month of their lives for 20 years, and yet the government had never taken the time to actually do all the diagnostic tests, morphology, brain, everything. And so LB and all these 4 or 5 individuals who were left in the program went up to Montana and did the whole diagnostics. It was all published in Ethan Russo's publication at the time, Journal of Cannabis Therapeutics. So there's a lot of information about how cannabis is being used in massive amounts over decades interplays with the body.
Thank you. Hello, my name is Robin Few, and I just suffered lymphoma. And I have a man sitting up there on the panel who saved my life, and I just really want to say thank you to Dr. Abrams and for all the work that has been done at Essex General Hospital. The cannabis program that it goes on in our hospital came to my room, took my picture, gave me my cannabis card right there in the hospital. Dr. Abram kept me on very low medication. We're talking about 1 milligrams, 5 milligrams. I mean, I was not going to come out a junkie. There was no way that I was going to be addicted to any hardcore drugs coming out of my chemo. And he made sure of that. And I was able to smoke cannabis. He encouraged me to vaporize. I'm a little bit old school. Told my mother from Kentucky she could have as much cannabis as she possibly needed, and that was the best thing I could have ever heard in my life. And I don't know what to say. I'm very fortunate and very lucky to be from here, and thank you, Dr. Abrams. You are fantastic and wonderful, and thank you all for all the work that you've done. And thank you, cannabis, for what you can do for all of us cancer patients. I have one argument that's going on right now with many people because chemo causes depression. People are telling me that I smoke too much cannabis and that's causing me depression along with my chemo. Can you address that? Thank you very much.
I can address that. Actually, Dagmar Antman, who is a PhD psychologist I woke up with, we surveyed about 300 people with ALS. Actually, they reported cannabis. If you have ALS and you're not depressed, then you need a reality check, unfortunately. They actually reported that depression is one of the things that cannabis is effectively treating.
I have a paper in Harm Reduction Journal basically saying that the cannabis users and non-users, any links to depression, were linked to medical treatment, not to cannabis use itself. So it's not that, what a surprise having cancer and AIDS does kind of depress you. Yeah. But when those people were no longer in the sample, we saw no difference between users and non-users as far as depression was concerned. So it only makes sense. This would probably be a reasonable way to code. I do want to point out, as a psychologist, though, we do have really interesting 12-session cognitive behavioral treatments for depression that often include things like going out and having fun, other outrageously intuitive things like that. And by all means, do as much of that as you can. The behavioral activation theory really supports that kind of intervention as well.
And I'd like to just say that in our research, even though we're not asking about depression, 13% of the people, the 907 people, said that they're using for depression. So they're self-medicating. And some of those are bipolar also, and also for anxiety disorders, or 10%.
I wanted to ask a couple of questions by throwing out some initials. I also want to mention about depression that it's one of the largest reasons for physicians recommending it. The reason that some people have more depression with cannabis is that it can accentuate emotions on the extreme. So if you're extremely depressed, it may make it worse. But if you're just depressed,